Hello everyone. Today's my lecture is on autonomic reflexes. Many visceral functions of the body are regulated by autonomic reflexes. Throughout this text, the function of these reflexes are discussed in relation to individual organ systems. To illustrate their importance, and a few are presented here very briefly. First of all, cardiovascular autonomic reflexes. Several reflexes in the cardiovascular system help control the arterial blood pressure and heart rate. One of these reflexes is the baroreceptor reflex. Briefly, the stretch receptors are called baroreceptors and are located in the walls of the several major arteries, including specially the internal carotid artery and the arch of aorta. When this becomes stretched by high pressure, the signals are transmitted to the brainstem, where they inhibit the sympathetic impulses to the heart and the blood vessels and excites the parasympathetics. So this allows the arterial blood pressure to fall back towards normal. Gastrointestinal autonomic reflexes. Uppermost part of the gastrointestinal tract and rectum that are controlled principally by the autonomic reflexes. For instance, the smell of the appetizing food or the presence of the food in the mouth that initiates the signals from the nose and mouth to the vagal, glossopharyngeal and salivatory nuclei of the brainstem. These nuclei in turn transmit the signals through the parasympathetic nerves to the secretory glands of the mouth and stomach, causing a secretion of the digestive juices, sometimes even before the food enters the mouth. Then defecation reflex. When the fecal matter fills the rectum at the other end of the alimentary canal, the sensory impulses initiated by stretching the rectum are sent to the sacral portion of the spinal cord and a reflex signal is transmitted back through the sacral parasympathetics to distal parts of the colon. These signals result in a strong peristaltic contraction and that cause defecation. Direct and consensual light reflexes. Afferent nervous impulses travel from the retina through the optic nerve, optic chiasma and optic tract. A small number of the fibers leave the optic tract and synapse on the nerve cells in the pretectal nucleus, which lies close to the superior colliculus. The impulses are passed by the axon of the pretectal nerve cells to the parasympathetic nuclei of the oculomotor nerve on both the sides. Here the fibers, synapse and the parasympathetic nerves travel through the oculomotor nerve to the ciliary ganglion in the orbit. Finally, the postganglionic parasympathetic fibers pass through the short ciliary nerve to the eyeball and to the constrictor pupillae muscles of the iris. Both the pupils constrict in consensual light reflex because the pretectal nucleus sends fibers to the parasympathetic nuclei on both the sides of the midbrain. Then accommodation reflex. When the eyes are directed from distant to near object, contraction of the medial recti bring about the convergence of the ocular axis and the lens thicken to increase their refractive power by the contraction of the ciliary muscles, and the pupil constrict to restrict the light waves to the thickest central part of the lens. The afferent impulses travel through the optic nerve, optic chiasma, optic tract and the lateral geniculate body. and optic radiation to the visual cortex. The visual cortex is connected to the eye field of the frontal cortex. From here, the cortical fibers descend through the internal capsule to the oculomotor nuclei in the midbrain. The oculomotor nerve travels to the medial recti muscles. Some of the descending cortical fibers synapse with the parasympathetic nuclei, means the Edinger-Westphal nucleus of the third cranial nerve on both the sides. Parasympathetic preganglionic fibers then travel through the oculomotor nerve to the ciliary ganglion in the orbit where they synapse. Finally, the postganglionic parasympathetic fibers pass through the short ciliary nerves to the ciliary muscles and the constrictor pupillae muscles of the iris. Then micturition reflex. Emptying of the urinary bladder is controlled in the same way as emptying of the rectum. Stretching of the bladder sends impulses to the sacral cord, which in turn causes reflex contraction of the bladder and relaxation of the urinary sphincters, thereby promoting micturition. Then sexual reflex. Also important are the sexual reflexes, which are initiated both by the psychic stimuli from the brain and by stimuli from the sexual organs. Impulse from these sources converge on the sacral cord and in the male result first in the erection of penis and mainly a parasympathetic function, and then ejaculation, that is partially a sympathetic function. So, major effects of autonomic nervous system activity. So, sympathetic effect and parasympathetic effect, and these are the all are effector organs in short or in a tabulated form. So, eyes, the structures, iris muscle and ciliary muscles. So, sympathetic effect, iris muscle contracts the radial muscle, dilate the pupil, and that ciliary muscle relaxes. In parasympathetic effect, contracts the sphincter muscle, so there is a constriction of the pupil, and ciliary muscle contracts, makes the lens to become more convex for the near vision. Now in heart, in sympathetic activity, SA node increases the heart rate via beta 1 and beta 2 receptor, and atria increases the contractility and conduction velocity by beta 1 and beta 2 receptors. Atrioventricular node and conduction system. So in sympathetic system, increases the conduction velocity via beta 1 and beta 2. And ventricles. So sympathetic effect is increases the contractility and conduction velocity via beta 1 and beta 2 receptors. Now in parasympathetic effect, in SA node, that decreases the heart rate, and atria in parasympathetic system decreases the contractility and conduction velocity. In AV node and conduction system decreases the conduction velocity, and also in ventricles decreases the contractility indirectly. Arterioles, especially coronary arteries in skin and skeletal muscle, abdominal viscera and kidney, penis or clitorius. So coronary artery in sympathetic effect constrict via alpha 1 and alpha 2 receptors or dilates via beta 2 receptors, and in parasympathetic effects there is a dilatation. Now in skin, there is a constriction via alpha 1 and alpha 2. In skeletal muscle, constrict via alpha 1 or dilates via beta 2 receptors. And abdominal viscera and kidneys. So constrict via alpha 1 and alpha 2 or dilates via beta 2 receptors. Penis or clitoris. Constrict via alpha 1, alpha 2 or dilates via beta 2. Now in parasympathetic effects there is a dilates that produces erection of penis. Now in lungs, bronchial muscles, in sympathetic effect there is a relaxation of bronchial muscles via beta 2 receptors, and in parasympathetic effect there is a constriction of bronchial muscles. Bronchial glands that inhibits the secretion via alpha 1 receptor or stimulates via beta 2 receptors, and in parasympathetic effect there is a stimulation of secretion. Skin, piloerector muscle that are contracted, erection of the hairs via alpha 1 receptor in sympathetic effect. Now sweat glands, localized sweating or via alpha 1 receptors, and in parasympathetic effects there is a generalized sweating, cholinergic. Lacrimal glands, there is a secretion via parasympathetic effect. Salivary glands in sympathetic effect stimulates the secretion, thick secretion via alpha 1, and in parasympathetic stimulates the secretion but watery secretion. Stomach and intestine. So motility and tone that decreases via sympathetic effect via alpha 1, alpha 2 and beta 2 receptors, and in parasympathetic there is a increases motility and tone. Sphincter. In sympathetic there is a constriction via alpha 1 receptor and there is a relaxation via parasympathetic effect. Third is secretion. So secretion is inhibited via sympathetic stimulation via alpha 2 receptors, and in parasympathetic stimulates specially enzymes. Now gallbladder. In sympathetic stimulation there is a relaxation via beta 2 receptor, and in parasympathetic there is a contraction. Liver. In sympathetic effect glycogenolysis via alpha 1 and alpha 2 beta 2 receptors and gluconeogenesis, and in parasympathetic effect glycogen synthesis. Now pancreas, exocrine gland, in sympathetic effect inhibits secretion via alpha 1 receptors, and in parasympathetic effect stimulates the secretion. Endocrine glands, so in sympathetic effect inhibits the insulin and glucagon secretion via alpha 2 and stimulates the insulin and glucagon secretion via beta 2 receptors. In parasympathetic effect increases the insulin and glucagon secretion. Fat cells, in sympathetic effect increases the fat breakdown, causes release of the free fatty acids via alpha 2 and beta 2 receptors. Urinary bladder, there are two structures, detrusor muscle and sphincter. So in sympathetic effect there is a relaxation of detrusor muscle via beta 2 receptors, and in parasympathetic effect there is a contraction of detrusor muscle. Sphincter, there is a constriction of sphincter via alpha 1 receptors and there is a relaxation of sphincter in a parasympathetic effect. Uterus, so pregnant, contracts via alpha 1 and pregnant and non-pregnant relaxes via beta 2 receptors. Male reproductive tract, in sympathetic effect there is a ejaculation via alpha 1 receptor, and in parasympathetic effect there is a erection of penis. Then there are certain differences between the sympathetic component and parasympathetic component. Sympathetic component, it is known as thoracolumbar division of autonomic nervous system, and parasympathetic nervous system, that is also known as craniosacral outflow. Cranial outflow is via 3rd, 7th, 9th and 10th cranial nerve, and sacral outflow is via pelvic branches of the 2nd, 3rd and 4th spinal nerves. In sympathetic division, the preganglionic fibers are short, myelinated and end either in the paravertebral sympathetic ganglion chain or prevertebral ganglion. In parasympathetic division, the preganglionic fibers are long, myelinated and end on the short postganglionic neurons located on or near the visceral structures. In sympathetic division, the postganglionic nerves are long and non-myelinated, and in the parasympathetic division, the postganglionic nerves are short and non-myelinated. Now in sympathetic component, upon entering the sympathetic chain, the preganglionic fibers travel upwards or downwards to form the sympathetic contacts with the ganglionic neurons in other ganglia. Therefore, the sympathetic activity is spread over many segments. And parasympathetic component, very few connections link the preganglionic neuron. Moreover, the parasympathetic postganglionic neurons are located within the organs to be controlled, so that the parasympathetic effect is localized and target is usually a single organ or system. In sympathetic component, it prepares the individual to cope with the emergency. Prepare for either flight or fight reaction as described by the Walter Cannon. For example, its stimulation. It relaxes accommodation and dilates the pupil, letting more light into the eyes. Increases the heart rate and blood pressure, providing better perfusion of the vital organs and muscles. Constricts the skin blood vessels, that limits the bleeding from the wounds. Decreases the threshold in the reticular formation, reinforcing the alert and arousal states. Increases the blood glucose and free fatty acid levels, supplying more energy. Because of these actions, therefore, the division of the autonomic nervous system is sometimes known as catabolic nervous system. And the major neurotransmitter released between the pre and postganglionic fiber is acetylcholine, whereas at the postganglionic endings is usually norepinephrine. In parasympathetic component, it is concerned with the vegetative aspects of day-to-day living. For example, its action favors the digestion and absorption of the food by increasing the activity of the intestinal musculature and increasing the gastric secretion and relaxing pyloric sphincter. Then dilates the sexual erectile tissues. Slows down body activities by decreasing the heart rate and force of contraction. Favors the storage of the absorbed nutrients by increasing glycogen synthesis and insulin secretion. Therefore, sometimes this division is also known as anabolic nervous system. The major neurotransmitter released at pre and postganglionic nerve ending is acetylcholine. This is the list of reference books. Thank you very much.